All right, everybody. Good afternoon. Welcome to the Scope at Lunch, a special edition of the Scope podcast. My name is Paige Heitman, and I'm your host for today's webinar. We're going to touch on a couple of housekeeping items just before we get started. First, this Zoom session will be recorded. We'd like to know who everyone is, so please ensure that your name is accurate. If you need help with this, please reach out to us using the chat box feature. I'll be moderating the session with my Phelps Health marketing colleague, Hillary McCash. So one of us will be sure to help you out if you need it. I'm letting people in as I'm talking. So please note that each of you are currently muted. If you have a question that pertains to the topic being discussed, please go ahead and add that question to the chat box, and we'll try to make sure that we can answer that question. You can also add comments in the chat box. One thing to note about the chat box is that you can send questions and comments to the whole group or just to one person. We would encourage you to send your question or questions and comments to the whole group so that everyone can participate in the discussion. However, you are also welcome to send a private question or comment if you feel more comfortable doing that. This session is a time for our Phelps Health panel of experts to share their knowledge and expertise of COVID-19 and COVID-19 vaccinations with each of you guys. We ask that you please be considerate and respectful of the panel members and the community members that have chosen to spend their lunch hour with us for this discussion. We also want to encourage everyone to utilize the reactions that Zoom offers during this discussion today. You can use a hand clap, thumbs up, thumbs down, etc., to let us know if you like, love, agree, disagree with whatever we're discussing. Reactions are in two places, one either on the top or bottom of your screen, and one you will see when you display the participant list. Also, if you're watching from our Facebook live stream, feel free to ask questions, comment, or show us emoticons during our conversation. We will be conducting a few polls throughout this Zoom meeting. We'll actually start with one today, so you'll get a chance to interact then if you choose. And of course, don't forget the chat feature. Some of you may be using a mobile device, while others of you are using a laptop or computer. If you find that your features are not the same, we just ask that you participate with us in any way that you can. If you have issues with your sound, the Zoom meeting, or other features, please use the chat box and one of our moderators will be happy to assist you. So before we dive in today with community updates, I want to give some quick introductions for each of our panel members. Carrie Haven is the Senior Vice President of Patient Care Services and the Chief Nursing Officer at Phelps Health. Dr. Nathan Ratchford is the Senior Vice President and Chief Medical Officer of the hospital and also serves the community as a gynecologist. Preston Hodap serves as the Patient Support Services Manager at Phelps Health and also plays a really integral part in COVID-19 vaccination efforts. So welcome to our show today, everybody. Like I said, we're going to go ahead and kick this off with a polling question. Let me go ahead and pop that up for everyone. Oh, Hillary, would you mind to do that polling session for me? It says that I am currently logged out. Technology is great until it doesn't work, right, everyone? Thank you for your patience. Let me try one more time. And it looks like it's not actually going to let us pull up that polling question. So we will just go ahead and skip that for right now. And we are going to go ahead and kick off with question one, which is for you, Carrie. What is the current positivity rate for COVID-19 at Phelps Health?
So our current positivity rate at Phelps Health is 5.2%, which is significantly less than it's been previously. When we look at positivity, we look at Phelps Health, which represents the patients or clients that we serve. So it can be from many different counties, but we also look at the CDC report of county positivity, and the CDC breaks it down by county and which county has a positivity rate that's higher or lower. So for example, Phelps County is at 5.7%, Pulaski at 1.7. So we really watch what the area around us is doing as well as what's going on here.
Great. So moving on to question two. Dr. Ratchford, this one's for you. Why does Phelps Health, in all the counties we serve, why do we continue to see decrease in positivity rates?
I know that later on in the program, you have some other topics that we're going to discuss, like immunity and things like that. But this is multifactorial. So we're seeing a decrease because a lot of people have been infected, and they likely have some immunity, we believe. They're not contagious anymore. More and more people are getting vaccinated, which is contributing to that. So, overall, we're seeing a decrease because of all of these things that we're working on.
Great. Question number 3, Carrie, we're going to go back to you. What does the acuity of patients at Phelps Health look like going into the second quarter of 2021? And maybe also just for our audience, what is acuity?
Sure. So the acuity of a patient is really how sick or how acutely ill they are, what it takes to take care of them. And when we say we have a higher acuity, that means the patient is more complex. It takes a lot of care from nurses and physicians to meet their needs. So we have patients that come in, we look at acuity to see what we need to do to be able to take care of those patients. And since probably November, the acuity here at the hospital has been very high. We have had many very ill patients, not just COVID patients, but also regular non-COVID patients. I think there are a lot of reasons for that. One of the main reasons is that patients are waiting to come into the emergency room. They have, through COVID, I think, stayed home longer because of maybe fear that they might contract COVID. We've had this environment where everyone's staying home. They are not dealing with medical issues like they normally would. So we've seen patients that come in that are much sicker than they would have been before because they've waited longer to seek care. So acuity is high. It does appear to be getting a little bit more normal than it has been the last few months. So we're hoping to see that normalize and see patients really re-engaging with their primary care providers and seeking care on a regular basis.
Yeah, that's great news. That's really good to hear. So moving on to question 4, Preston, this one's for you. How many new variants of COVID-19 are there, and should we be concerned about this? I know this has been a topic that's been pretty popular.
So according to the CDC, we're currently monitoring 3 new variants of the COVID-19. They have originated from the United Kingdom, South Africa, and Brazil. So far, the studies are showing that people that have been vaccinated do show antibodies that will fight against this virus, and you will be protected against the new variants. The CDC is closely monitoring the variants, and more studies are being completed to see exactly what else we need to know about them. We should be concerned about these variants because what we have found out is that these variants seem to spread more quickly and easier than other variants of COVID-19.
Great. Thanks so much, Preston. That actually leads me right into my next question for Dr. Ratchford regarding the new variants of COVID-19. Are they more transmissible, and why should we be worried about that?
Yeah, one of the things you've got to remind yourself about COVID-19 is that prior to just 16, 17 months ago, no one had even heard about COVID-19. We're learning new things every day about it. And we talk about the fluidity of the situation here at Phelps Health. We've had to match our response to the situation quite often. And as far as these new variants go, the initial studies appear that it is more contagious. And if you do get one of these new variants, that people tend to be sicker. However, the vaccine does seem to reduce severe disease. So we're still encouraging people to get vaccinated, even though we're aware that these variants are out there.
So Dr. Ratchford, a follow-up question for you. Is it common for a virus to mutate as COVID-19 has?
Sure, not every virus can mutate, but COVID-19 is a coronavirus, which is a virus that we're very familiar with that is known to mutate. I think the best example that most people are familiar with is influenza. We all get our flu shot every year because we recognize that virus mutates, and there's typically a different strain every year. Probably COVID-19 will become a similar situation. So this mutation of these new variants is not surprising.
Great, thank you so much. So moving on to question 7, now we're going to start a series of questions regarding vaccination efforts, which I know is really top of mind for everybody right now because we're still currently vaccinating for COVID-19. Preston, we're going to go ahead and kick this section off with you. What can you tell us about the vaccination process for Phelps Health?
So in order to get vaccinated at Phelps Health, you are required to have an appointment to obtain the vaccine. Currently, we are administering the vaccines at our off-site location at the Rolla Church of Christ, which is located off Highway E. Of a morning is when we are primarily doing our first doses. Of an afternoon, we have set aside for our booster, or what we call second doses of the COVID-19 vaccine. When a patient receives their first dose of COVID-19 vaccine, they receive a card that will have a date on the back when they're supposed to return for their second dose. The patients are automatically scheduled for a second dose on that date. The patients will receive a call 5 days prior to that date, letting them know that the time they should be at the vaccine site. The patients do have the option at that time, if that date does not work with them or the time does not work with them, to connect to a live person and reschedule that appointment. Starting April 5th, which will be this Monday, we will be moving back to our drive-through location for the vaccines, and the process will be the same as it is at the church currently.
Perfect. Thank you so much, Preston. So moving on to our next question, Carrie, this one's for you. So to date, how many people has Phelps Health vaccinated?
To date, we have vaccinated 21,623. We've given that many vaccines. That breaks down into 13,054 first doses and 8,279 second doses. So I would say that 8,279 are fully vaccinated. They're probably in various stages of the 2 weeks after the vaccine. We say after that 2 weeks, you probably have maximum effectiveness of the actual vaccine. So we're over 21,000, which I think is a great number. We do see people from a lot of different areas, but we are excited as that number continues to rise.
Yes, I love seeing that number go up. I think that's really fantastic for our community to kind of, I say, get back to normal, right?
Yes.
So moving on to question 9, Dr. Rochford, this one is for you. Why is the vaccine not more widely available right now?
Mostly it goes back to supply and demand. So the vaccine, although the technology used to develop the vaccine had been in place already, the actual COVID vaccine was developed and produced in a really recent time frame. I know that the companies that make the vaccines are trying to produce it as quickly as they can to meet that demand, but there's still a limited supply. And then at the local level, our actual available vaccine, after it's from the federal government, it's sent to the state level, and then the state decides where the vaccines go and which hospitals and healthcare organizations in the state give it. That's the number that we're given. And then in order to target the parts of the population that are most susceptible, that's when they started the tiered system. And so certain people in different tiers had access to the vaccine. And then unlike the flu vaccine, which pretty much anybody could get, the vaccine is not approved for children younger than 16.
Great, thank you. So question number 10, let's talk about people maybe who are under 10. What are other ways to protect ourselves from COVID-19 besides being vaccinated? Dr. Ratchford, if you'd like to go ahead and answer that one.
Yeah, I mean, we've talked ever since the beginning of all this back in February and March about social distancing, frequent hand washing, wearing masks. That really hasn't changed. I know there's been a little bit of information recently about for people that are fully vaccinated that they can start relaxing some of those things. But to the extent that COVID-19 is a contagious virus, it's kind of common sense. The things that you would do to reduce transmission are going to be the best things for people to focus on if they haven't been vaccinated.
Perfect. So question number 11, Preston, we're going to give this one to you. What vaccination phase is Missouri in, and what vaccination phase is Phelps Health currently in? Because I know those two don't always marry up perfectly.
So Missouri just opened up phase 2 on Monday, and Phelps Health is currently mirroring that. We are also in phase 2 at this time.
Great. So then a follow-up question for that is, Carrie and Dr. Rochford, Preston, maybe even you, why is Missouri so far behind in vaccinating its residents as opposed to other states?
So I'll start first. In the beginning, when we started getting the vaccine, the federal government gave an allotment of vaccines to each state. And when we started, we thought we were going to get a certain number, but the state didn't get that number. So therefore, we didn't get that number as well. So we started out behind, and now we're trying to play catch up. So it was really about supply and demand, which Dr. Ratchford alluded to. And I think that's why our rate has been slower to start. And I don't know if Dr. Ratchford or Preston, if you have any thoughts about that, any other causes.
I'm going to take that as a no. Great
Well,
job, Carrie.
I will throw in on a bright note.
Uh-huh.
I haven't spent as much time actually in the vaccination area as what Preston has, but our staff has done a commendable job getting the vaccine out as quickly as they can. You've probably seen reports where vaccines have gone wasted at certain facilities and things like that. And Cindy Butler, who is she's kind of in charge of the whole process, she told us just yesterday they haven't wasted a single vaccine, which is fantastic. So even though it's frustratingly slow for the reasons that Carrie alluded to, I really got to pat our staff on the back. They're doing a great job getting what's available to us out.
Great. Thanks so much. Preston, anything to add to that?
I do not. I mean, definitely, as Dr. Ratchford has said, we have not wasted a single vaccine. We've done everything we have to find someone to get that vaccine to. So we do see a lot of people from outside of, kind of our normal area, but we are, we'll vaccinate whoever we need to, as long as they meet the criteria.
Yes, I think we're all ready to get herd immunity so we can go back to, living our lives, going to concerts, that kind of stuff. So Preston, I have a question for you as well. If somebody can't make their second appointment date, why can't they go to another location or to get their shot or just come in on another day? Why is it so important that people come in on the date that they're supposed to?
So this is probably one of the most common questions I get asked at the clinic. So whenever a patient gets their first dose, their second dose is shipped to the same location as their first dose was. So they have to come to that same location to get their second dose. If a patient's unable to make their second shot on the date that it's automatically scheduled, it's very important for them to go ahead and make sure they cancel that appointment or reschedule that appointment. The vaccine does not come in single dose vials, so we have to, as a clinic, prepare and plan to make sure that we are able to get each dose used in the correct manner, that we use second doses for second doses and first doses for first doses.
Yeah, I think there's a lot of science behind that maybe is just not public knowledge. So a follow-up question for you as well, Preston. Why does somebody need to receive the same vaccine for their first and second doses? Why is that so important?
So if a patient receives the first dose Moderna, they have to get the second dose Moderna, the same as Pfizer. This ensures that we are practicing the most safe measures and the efficacy of the vaccine. Currently, we do not have any research of mixing the vaccines, and it's as far as mixing the vaccines, it's not supported on any government level to mix the vaccines.
Mm-hmm. Great. Thanks so much. So this is a question we often get asked on social media, and I'm sure that you guys probably get asked this too at the vaccination stations. Dr. Radford, what vaccine is the safest? Are they all safe?
So I think what this question is getting at is how likely are you to have some significant side effects from one of the vaccines? And as far as safety is concerned, the vaccines are all equivalent. There's not one vaccine that's superior to the others in terms of safety. I would add that the Johnson & Johnson vaccine, which we don't have available yet, it's the newest one, it's the single shot vaccine. Anecdotally, I can tell you that it's a very common situation for people to have viral illness-like symptoms with either shot, but mostly with the second shot. So there is a potential with the Johnson & Johnson vaccine to if you do experience that, you just have it once instead of potentially twice with the other vaccines. But if someone has the opportunity to receive any one of the 3 currently available vaccines, I wouldn't base that decision on any kind of safety concern.
Great, thank you so much. So Carrie, I've got a follow-up question for you based on what Dr. Ratchford just said. Is one vaccine better than the others? The Johnson & Johnson, how that's just one shot?
No, they really are not. The vaccines, Pfizer and Moderna vaccines work differently than the Johnson and Johnson vaccine, and they also are 2 shots versus 1. I think that some people vote for 1 shot because it's 1 shot and not 2. And like Dr. Ratchford said, you may have symptoms twice instead of once, but they're all effective, and there's really not evidence that one is better than the others.
So a follow-up question that I have is, what happens whenever we get a vaccine and we get sick or whatever that is? That's an immune response, right? That's completely healthy to have after getting a vaccine.
Correct.
That's correct.
Totally normal.
And what are some things that might happen when somebody has an immune response? So would one of you guys be willing to answer that?
Yeah, I mean, most people have some malaise, like they feel maybe weak or tired, less energetic than they normally would. They can have a low-grade temp. They can have muscle aches. Headaches are a common thing for people to experience. These things are usually temporary. They usually last a matter of hours up to a day or so. And then for most healthy people, they go away pretty quickly on their own.
Great, thanks so much. So our next question, Preston, is for you, and I know you kind of talked about this at the beginning. How can people register for COVID-19 vaccine?
So if patients currently have a MyChart through Phelps Health, they can get on the wait list and register that way through MyChart. If they do not have a MyChart, our marketing team does a great job to put out the link where they can register online. That link is shared on our Facebook page, and they can get an appointment that way. If we do have people that do not have computer access or not able to do the computer, we do have a phone number. It's 573-426-2684, and you can connect that way, and you can talk to a live person to obtain an appointment for a vaccine at that time.
Great. So question number 19, we're just kind of moving right along. Now we're going to be talking about continued safety measures for COVID-19 because this continues to be a very fluid situation, and Phelps Health is doing the best that they can to make sure that everybody stays safe. So Dr. Ratchford, we're going to start off with you for this one. Is it still important for people to wear masks, social distance, and practice good hand hygiene right now?
Sure. Carrie reported earlier, our numbers for the vaccine that we've given out are impressive and they're really encouraging, but you've got to keep in mind that's still a very, very small portion of the population. There's the majority of people have not been vaccinated. We can theorize, but likely the majority of people have not been exposed and recovered from COVID-19. So it's still out there. It's still a serious condition. We still have people in the hospital for it. Especially if you're not vaccinated, it's really important to continue with the social distancing, the wearing a mask, good hand hygiene. These things are important still.
Yeah, even before COVID-19, those things were really important, right?
Yeah, I mean, I know I've mentioned the influenza a couple times, but this past year was one of the record lows of influenza. And we think that's because so many people were washing their hands, avoiding contact with others, wearing a mask. And influenza is just as contagious as COVID-19. It's just typically it's less severe symptoms.
Mm-hmm. Yeah, so really good information to know. Everybody wash your hands. So Dr. Radford, I have another question for you as well. When will we reach herd immunity?
So I hate to be negative, but there's good information out there that we probably won't reach herd immunity. And it's probably more complicated than what this venue permits. But in order to get to herd immunity, you have to have a disease that you can vaccinate against effectively, that the vaccine prevents people from being both contagious and transmitted to someone else, and you have to have a really high adoption rate of the vaccine. And the scientists and the researchers that are looking at this right now, there's a lot of doubt as to whether or not we'll actually reach herd immunity. The thinking now, we talked about herd immunity a lot last year, especially, and the thinking now in the scientific community is that we're probably a better goal is we're going to work towards living with an endemic disease. So again, to compare to influenza is an endemic disease. We all recognize that every year there's the flu season. I don't know if there will be a COVID-19 season, but it's pretty likely that COVID-19 is going to be permanent. It'll wax and wane with maybe seasons and vaccination rates and things like that. But unfortunately, again, a lot of this is so new that we're just going to have to monitor the situation, and we'll see what the future brings.
Great. Thank you so much. So for our next question, Carrie, this one's for you. Do we know when we might be able to stop wearing masks? I know coming off the cusp of, we're in an endemic potentially. What does that look like?
Well, I personally have seen a lot of people stop wearing masks out in the community and in the stores and different places, but there really is no indication that we should stop anytime soon. Dr. Ratchford just talked about how this is likely not going away. We more than likely will not reach a herd immunity point. So face coverings are important, but also social distancing, washing hands, those are an important piece. And the other thing we have to remember is we have now seen 3 variants of COVID-19 from United Kingdom, Africa, and Brazil. So that may continue. We may continue to see variants, and we don't necessarily know that vaccines will protect against all of those. Much like the flu shot, you can get the flu vaccine and still get the flu. So it really is important to still be cautious. I know we all really want to get back to that normal state, but this or a version of this may be the new normal.
Great. Thanks so much, Carrie. So Preston, I have a question for you, kind of following off the cusp of what Carrie and Dr. Ratchford were just talking about. What's the value of getting vaccinated if we're still going to have to social distance, wear masks, and essentially can't go back to our normal lives?
So the value of getting vaccinated, all the 2 vaccines that we're currently using at Phelps Health have at least 90%, if not more, effectiveness against COVID-19. So, I mean, you have a very high rate of not getting COVID. Also, all 3 vaccines that are offered in a recent study shows that they're all 100% effective against death from COVID-19. The CDC, as Dr. Ratchford kind of stated earlier, has recently stated that if a small group of individuals who are fully vaccinated, which means it's 2 weeks after their second dose, want to gather indoors, they can without social distancing or wearing a mask. Also, if you have been fully vaccinated and you've been around someone that's tested positive for COVID-19, the CDC is stating that you do not have to quarantine or go get tested unless symptoms arise. However, if you do live in a group setting, such as a correctional facility or a group home, they still want you to distance yourself from others and get tested, even if you do not have symptoms and you've been vaccinated.
Perfect. Preston, thank you so much.
Hey, Paige, I'd like to emphasize really quickly before you move on that, talking about the value of getting vaccinated, even if the reduction in transmission rate for people that are vaccinated isn't 100%, it's still quite good, just like what Preston said. So reducing that transmission rate, there's value there. And then definitely, even with the new variants that are coming out, there's good data that shows that people that were vaccinated are much less likely to have severe illness, not just death, but people that end up in the hospital. If they are in the hospital, how likely are they to be on the ventilator support? These are important too. So, I know with any vaccine, we all know people that claim that hey, I got the vaccine, but I still got sick, or I got the vaccine, and I know somebody else that got sick. Unfortunately, vaccines are not 100%. We recognize that, but they definitely reduce the risk of transmitting the disease. And if you do get sick, you're less likely to be as sick as you would have been without it.
Yeah, it's less likely to be severe or to put you in the hospital. Great. So moving on to question 23. Carrie, I know our visitor policy has changed a little bit now that our rate has gone down. Would you be able to speak to that?
Sure. Visitation in the hospital has been a hot topic since COVID came around. We have gone from very restrictive and no visitors at all to allowing some visitors. And what we do is we look at those positivity rates in the different counties that we serve, and we come up with an average that guides us as those rates change, which level of restriction we should be at. So currently, we do have some restriction in place. We allow one visitor a day for hospitalized patients that can come between 10 a.m. and 7 p.m. That we allow 2 visitors at a time for end-of-life care patients. We allow 1 visitor for emergency room. One visitor or support person for surgeries, and 1 visitor in the clinic setting as well. And that includes prenatal appointments. And then for labor and delivery and postpartum moms, they have 1 support person that can stay with them throughout labor and during the hospitalization. And then our peds patients are allowed to have 2 parents or 2 guardians with them during the stay as well. So there is still some restriction. And we know as a whole, the hospital really does recognize that visitors are critical to healing for patients. We recognize and understand that. As a family member, it's important for us to see our loved ones that are sick and vice versa. So we want to encourage visitation as much as we can, but doing it safely. And so we do watch those positivity rates closely and adjust those visitation guidelines based on that indicator.
Perfect, Carrie. Thank you so much.
You're welcome.
So our polling questions are not working, so we're just going to jump right on into participant questions, and I'll just throw these out, and then whoever feels most comfortable answering them, please feel free to go ahead and answer that question. So the first one that came through was, will we need more vaccinations? Similar to the flu, will we need to go and get a COVID vaccine every year?
I would say likely yes. Again, to be determined. We're going to have to see what these variants do, and we still don't know how long the immunity lasts from the vaccines that we're giving. Probably just based on biology and our understanding of how vaccines work, they probably last from 3 months to more than a year, but it's too early to say for sure.
Great, thank you, Dr. Ratchford. Our second question that came through was, if I got vaccinated for my first dose and I can't make my second dose, can I still come after the 2-week period?
So a patient can still come after their 2-week period. However, they will need to call that 426 number that I told earlier to schedule an appointment. The CDC is stating that within 6 weeks of your first vaccine, that you should still have a good effectiveness of the COVID-19 vaccine.
Great, thank you so much, Preston. Our third question that came through was, do you foresee masks becoming more normalized during every flu season?
I think that's a good question. I think there is definitely evidence that wearing a mask during this current flu season has absolutely reduced the transmission of influenza. We have not seen very much of that this year. I'm going to knock on wood as I say that. So whether or not it becomes normalized, that's a good question. There are people obviously that are pro mask wearing and people that are not, but I think we will see more in our community, in the country, that choose to wear masks because there is evidence that shows that it does keep you safer. It does reduce transmission of flu. So I'm not sure it'll be normalized, but I think we'll see more people choose that option.
Great, thanks, Carrie. You know, from a marketing perspective, I think masks may become more normalized because they're fashionable now, right?
Absolutely.
You can get one that really fits the theme of who you are as a person.
Yes,
So
yes.
I
would
say that mine's
also-
black.
I would also add that normalize is probably the right word to use,
Mhm.
because I'm not going to touch the politics that are around masks. I think we all recognize that that's a sticky subject, and I personally don't know what's right or wrong. But from a public health perspective, and as a healthcare professional trying to help patients avoid the consequences of this disease, I think it is going to become more normal to see people wearing masks out in public. You've got to keep in mind that it's very common in some countries that people choose to wear masks while out in public. And, to use the word normalized, you go to these other countries, and coming from this area where it's typically not common for people to wear masks, you notice that. But I'm confident for people that live in countries where it's a common practice for some people to wear masks, they don't even give it a second thought when they see people wearing a mask. So I can't say I like that, but my prediction is that there will be some people in a population that, regardless of where we go with this COVID-19 pandemic, some people are going to continue to choose wearing masks for their own personal reasons.
Right. You saying that also made me think whenever COVID-19 first began for our organization in March of last year, we kind of were equating wearing a mask to putting on your seatbelt. It's something that you do every day when you get in your car, hopefully. So masks maybe will be the next phase of our seatbelt wearing, is we'll just grab our mask as we go out if people, feel comfortable doing so. If they don't, that's absolutely their choice.
I would say there's a lot of people that's already got to that level.
Hmm. So one of the last questions we had is it appropriate to ask someone if they've been vaccinated?
That's a good question. I will give my opinion on it, and then Preston and Dr. Radford may give theirs to follow. I think it's a question you have to be sensitive about. Some people are very private, and some people may be offended by being asked that question. But I think that people will be asked that more often as we move forward, because that dictates some of whether or not other people in the area have to wear masks, whether how socially distanced you have to be from other people. So I think it is in some settings appropriate to ask that question. If you're a community member and you're having people over for a gathering, you may ask, are you vaccinated? And it's not because you're nosy, it's more about keeping everyone safe and making sure everyone's aware that this is the situation, and you may want to keep your mask on, or you may want to really make sure you stick to 6 feet away.
Great. Thank you. Preston, Dr. Rashford, anything to add to that?
I mean, I would just add, I would say something similar to what Carrie said, but I would say it depends on the context.
Mm-hmm.
We treat healthcare privacy seriously, and I think as a society, most people know what's right and wrong to ask people. You wouldn't go up to a stranger and ask their weight, or ask them what medications they're on, or what surgeries they've had. And I think in a lot of circumstances, whether or not you've been vaccinated for COVID-19 also falls in those similar categories. However, if you are in a personal, social, professional situation where you're trying to protect yourself or others, I think it should be appropriate to ask if somebody is vaccinated, and they need to understand why you're asking. You're not asking out of curiosity. You're asking because you are trying to do the right thing, and I think that should be an okay thing for people to ask.
Great. Thanks so much, Dr. Ratchford. Our department over in marketing, we actually just had this experience this morning. We filmed some of these Scope podcasts live in my office. As you can see behind me, we have the sign, and the provider that was on had also been fully vaccinated, as have I, but we decided just for this show to leave our masks on. But I think moving forward, it's completely appropriate to make sure everybody's vaccinated in the room. And if they are, then that's great, because we don't have to wear our masks.
Right. And to take that one step further, if someone is not vaccinated, I don't think that should be looked upon as a negative thing.
Mhm.
There's complicated reasons for why people may or may not choose to get vaccinated. And if someone is not vaccinated, that is not an invitation for the next logical question, which is why not? If someone ever tells you that they're not vaccinated, that should be the end of the discussion. So.
Mhm. Yes, great advice. So that is it for our participant questions. So we'll go ahead and wrap up. I apologize that we weren't able to view our polling questions today, but thanks so much for everybody tuning in for the Scope at Lunch. A huge thank you to our panel members for joining us today. I know this topic continues to be very fluid and we really appreciate your expertise. We appreciate all of the insight you've been able to share with our community today. As a reminder, this show has been recorded and will be emailed to participants. It can also be rewatched on our Facebook page and shared with family and friends who may have missed the show. If you liked the show and would like to know more, check out our other episodes of The Scope on YouTube or visit phelpshealth.org. Have a great rest of your day, everyone.
Thanks, Paige.
Thank you.